Welcome to this webinar delivered by the ISM Trust. Very pleased to be here with Nick Pahl, who's the CEO from the Society of Occupational Medicine. I'm Claire Cordeaux. I lead the British Association for Performing Arts Medicine, and I'm just going to do some housekeeping-y bits before we get on to the main content of the webinar. So the content of this presentation is for information purposes only. It's not intended to be a substitute for legal or other professional advice and shouldn't be relied upon as such. You can contact us about your specific situation, and ISM members can contact the ISM legal team, and certainly Nick and I have put our details, so if you want to talk to us at all individually about anything that we've said or anything you find interesting, please do get in touch with us. You can't see me or Nick, although we've got our picture, I think, on social media, but you ought to be able to see the PowerPoint which is displayed on the screen. You also should be able to hear me, but we've muted you, so we can't hear you. So if you experience any technical difficulties, there's a chat box on here, and you can put your message in there, and it'll be picked up by the technical team, and they'll try and sort out the issue for you. And I think that's the same box that we'll ask you to put any questions in, and you can put them in during the webinar and we'll pick them up at the end, or you can pick them up at the end when we're dealing with questions. The webinar is being recorded, and it'll be available to view on the ISM's website, which is ism.org/webinars. Okay, so with that, then we're going to start the main content of the webinar now. I just wanted to say a few words about BAPAM, the British Association for Performing Arts Medicine. We're a charity that delivers specialist healthcare to performing artists in the UK. We have clinics all over the country, and we have over 160 specialist clinicians who are used to looking after performing artists and who are qualified in a whole range of specialisms of the sorts of things that performing artists and particularly musicians might suffer from. And also, because we have that expertise, we do a lot of training in health promotion to try and stop the problems from happening in the first place. I'm just going to hand over to Nick now to...
So the Society of Occupational Medicine, we're the largest nationally recognised professional organisation for individuals with an interest in health and work. And we've got about 1,700 members who are mostly occupational medicine professionals, doctors, nurses, physiotherapists, psychologists, etc. We also have 3 patrons, Lord Blunkett, Dame Carol Black and Norman Lamb, MP, and we use them to provide a national voice for occupational health and workplace health, and we engage with the government and policymakers to increase awareness of the role and value of occupational health.
Thanks, Nick. I'm so pleased that you're able to join us today, because we very often talk about health and music and performing arts in our own sector, and understanding the broader picture, what everybody else is doing, what all the other occupations are doing in occupational health. I'm really looking forward to hearing what you're saying and how we can learn from it to improve the services that we're offering. So what we're going to cover today is health in the performing arts. What's the current picture, what the support that's available is, and some of the outcomes for people, and I'm going to hand over to Nick at that point to talk about the wider picture in occupational health, and then we'll turn it over to everyone listening for questions. So just to start with then, when you're looking at performing arts, and you can see musicians particularly picked out there, and the numbers in our workforce as defined by the Labour Force Survey, the key point here, I think, is that 82% of us are self-employed. So we don't have an employer looking after people's health as they might do in an employed situation. And I'll come on to talk a little bit about that later. Health issues in the performing arts. There's a high prevalence of mental health problems and suicide, and I think everybody listening will be very well aware of that. There's been a lot of campaigning about it. But there are also injuries related to intensive and repetitive use of parts of the body. So if you're playing an instrument and you're practicing for many hours a day and performing, then it's very likely that there will be injuries at some point as a result of that. And we certainly see a lot of musculoskeletal injuries and vocal injuries as well at BAPAM. And hearing and sight, of course, and you'll be well aware of some of the issues in hearing. We get a few people with sight problems where you're trying to look at the conductor and also look at your music stand. So the research says that performing artists have a 75% lifetime prevalence of injury. So it is more normal to actually have an injury as a result of this than it is to be injury-free. The other thing I wanted to mention about the context in which musicians and performing artists are working is the environment. So I think there are a number of challenges within that. There are lifestyle challenges, trying to have a healthy diet when you're working in different places and at different times of the day and night is hard. Sleep, getting regular sleep patterns is difficult. It can be quite an isolating lifestyle, really, because you're not necessarily socializing with everybody else at the same time. And so participating in some of the things that everybody else is doing is harder. Taking regular exercise. We know some of the facts about misuse of drugs and alcohol, and for people who are putting on their own shows, there's an awful lot of heavy lifting of gear in and out, and depending on what instrument you play, you might be lifting a lot of stuff all the time. So there's some challenges just to your health in that. But of course, there's also the challenges related to performance. It's a very high intensity role that musicians are playing, very high expectations on performance. A lot of people will know a lot about perfectionism and always trying to get it absolutely right. There's a lot of competition as well, and so even though your colleagues you're working with very often are the people you're closest to, actually very often you're also competing, and so symptoms, you might not go and seek help for the symptoms that you have for any health problems because you're worried about not being able to do the next concert, the next gig, maybe getting dropped from something, and you're less likely to perhaps mention it also to your peers because you don't particularly want them to be listening out for any mistakes you might be making. So it all gets a bit hidden. And then there's issues of venues. Some venues are amazing, some of them are difficult, they're not so accessible, and then there's the noise issue as well. So all of that environmental stuff also contributes to people's health. When it comes to accessing specialist support, I've mentioned the intensive use of specific parts of the body. What I haven't said is that if you go to the NHS, your GP may not see many elite musicians who are doing this all the time, and so they might not necessarily know where to go for the right specialist support. Mental health problems, yes, I mean GPs are very used to seeing mental health issues in their practices, but not necessarily performance anxiety, which is very specific to musicians. In addition, even if you find the right specialist support, then having an healthcare intervention which fits with your performance schedules, with your touring, with everything else isn't very straightforward either. And the importance for your occupation isn't always well understood by mainstream healthcare. So there's people we quite often see with vocal health problems, and of course if they go to a mainstream speech and language therapist who's not used to dealing with a professional voice user, then they might say, well, you seem to be talking very, very well. I can't really hear a problem compared to all the patients I'm normally seeing who've lost their speech through some sort of condition that they have. And so getting that specialist support that really recognises the importance of health for the occupation is not that straightforward. So that's a bit of a bleak picture really, but it's just really to point out that within this occupation there are a number of different factors which contribute to occupational health problems within our sector. I've mentioned common freelance issues here, and I know that Nick's going to come on and talk a little bit more of that. But actually, what musicians have in common with lots of other people who are freelance is that there are higher levels of stress and anxiety. There's the financial pressures from not knowing quite when you're going to get the cash come in. There's the inconsistent hours, and it's hard to switch off or take a holiday because you don't know what you might be going to miss. And that's true for everybody. It's not just true for musicians. And I've put a couple of examples here of what performers say. And the first quote really picks up those issues, that the lack of job security, the financial pressures, the isolation, you're working with everyone else is socializing. But in order to sort of mitigate some of this, I just wanted to put in Quincy Jones's quote here, which is, I think, really reflects that most people in this profession are doing it because they have a passion and there's a joy in the music, and it's a calling, and I think we have to also, it's not all doom and gloom. There's an enormous amount of benefit to being a musician, but also there are huge benefits to other people who are hearing the music, watching the music, and there's a lot of work being done now on prescribing musical activities in order to help people who are not very well. So I don't think we mustn't forget that. So I wanted to talk a little bit about some of the patient stories, and these are composite stories. This is not about individual people that we see in our clinics at BAPAM. And this is a story about somebody with a vocal health problem. They noticed a change just quite recently, and parts of their range started to disappear. They've tried practice. They've tried resolving it with practice, and also with rest, but not really had any joy with that. And so they're actually reducing their repertoire to try and manage the problem. And so our clinical advice as an organisation is our medical director will write to advise the NHS GP to get a referral to a multidisciplinary voice clinic. And this is really important because it's a multidisciplinary clinic and voice problems can be caused by so many different elements. And so you will get an ENT, you'll have a speech and language therapist, you'll have a physiotherapist, very often a psychosocial practitioner, and a rehabilitation performance coach in some of these clinics, which means that you can very quickly get an accurate diagnosis. And this is what we would advise to this kind of patient. It means you're not pinging back in between different clinics and keeping going back. No, that didn't work, to the GP. Can I get referred somewhere else? You can get it all done in one big diagnostic process and make sure you get the right care pathway and the right treatment going forward. And in this particular case, people are back to work within 6 months and with a full repertoire. The next patient story, and in this series of webinars, there's going to be a session on musculoskeletal problems, injury prevention with Sarah Upjohn. So I'm not going to go into this in a lot of depth, but of course there are issues that are problems that are caused to musicians because they are trying to keep healthy. They're running, they're going and taking exercise, and then that might cause an injury, and that causes a problem if you've got a run of shows coming up. So in this particular case, somebody's really needing to be fit within a specific period of time in order to be able to do that. So in this case, BAPAM can set up an assessment with a psychotherapist who's used to seeing a musician and provide advice and exercises, and also potentially further consultation with a rheumatologist if there are further problems, and can recommend treatment to the GP so that the performer is able to get the treatment that they need and manage their condition. And then finally, this is an example about anxiety, performance anxiety, managed by this particular patient over a period of time, but actually feeling like they need a bit of help now. And again, a clinical assessment at the earliest stage is very, very useful in making sure that the right sort of therapy can be accessed. And in many cases with our work, we can help people access funding for private treatment if that's what's required, and if there's a waiting list in the NHS, and also to see somebody who understands performance anxiety from a musician's point of view. So this is just a quick summary of some of the support that's available. It's not all the support that's available, but it's some significant places. So my own organisation, BAPAM, is there. Help Musicians has also got a Music Matter helpline for mental health, has a hearing health scheme, and also can support in some cases with funding. And then Music Support is offering services for probably more acute mental health issues and also addictions. So there's quite a lot out there for people who are wanting help. And I've listed some resources there. At BAPAM we have advice and fact sheets, but also the ISM has a psychological toolkit for musical performance, and the link is there so that you can access that. So the impact of interventions, we follow up our patients after about 6 months to see what the impact is of getting that early clinical assessment with the right practitioner, and what happens as a result of that. What are the outcomes? And we would say that getting that timely help as early as you can from the right practitioner does make a difference. We get 60 people back to performance in 6 months and a further 25% back to partial performance. And getting that right advice for your particular condition can help you to sustain a healthy career. So that's just an overview really of some of the issues to think about in occupational health for musicians. And I'm going to turn over to Nick now.
Okay, thanks, Claire. So actually one thing that you just said in terms of timely and early intervention, I think really resonates. And I think our experience of the workplace and employees and self-employed people is the earlier someone goes to an occupational health professional or someone who can advise them to help them get back to work, the more likely they're likely to return to work. And that is almost from day one. And there's been work in Scotland where people were literally talked about their issue on their first day off sick, and they had the best chance of return to work. So timeliness, I think, is critical. So we've done a evidence synthesis of the research in occupational health, and this slide just covers the number of references and reassures you that it was a rigorous piece of work. And I'm going to run through the evidence base in terms of occupational health and workplace health generally, and hopefully you can see what this means in terms of musicians' health. In terms of the cost, it does break down mostly in terms of the cost for the performing artists, for you as musicians, in terms of lost income, but clearly there are costs to government in terms of state benefits and the employer too. So everyone shares a stake in this, and the government is interested in doing more in occupational health because clearly they don't want to pay out state benefits. But also, if good work is good for you, which we know it is, then it's in everyone's sort of mental health and general well-being to be at a work that they love, which hopefully you do too. I know there's going to be a webinar coming up on musculoskeletal health, and that's obviously a big area, along with mental health. Those are the two big issues for the UK sort of workers, employees and self-employed. And here's a slide that just runs through why it's such a big issue, the days lost, the prevalence, and really the impact this has. So if you have a musculoskeletal issue, you're not alone. And, it's a big issue for the economy generally and for people generally. So these are the three reasons that are often focused on for why it's good for employers and your contractors to focus on workplace health. And the first one, sadly or realistically, is financial. And this could be cancelled shows or last-minute replacements. And you know, there's big costs for anyone who sort of is affected by this, anything from 2 to 16%. Legal, that can be one where directors get particularly concerned. You know, are you meeting the Qualities Act? Are there reasonable adjustments being made? If not, then off you go to a tribunal, and the reputation of that company is shot away. So that can be a sort of backstop fear factor, and there are a lot of occupational health related employee tribunal cases. And then there's the moral case. I mean, I think people, big corporates, corporate social responsibility, but clearly, everyone has the right to be healthy at work and have the best chance to return to work. And here's some good examples. HS2, as much as I live near HS2, I hate it. Actually, they're very good on looking after their employees, and they've got a contract where no one has to go to GP and everyone has occupational health. There's something called BNCE, and they're a bit like a kind of umbrella body for the construction sector. And they've just developed this health passport, and that might be something for musicians to think about. As you go from job to job, you can reassure your employer, but also your employer can be reassured that you've had some health check. What checks have there been? It all sits on a nice app, and you can go from job to job and build it up. And I would suggest that happens in this sector. And there's an excellent example that Claire's highlighted in terms of One Dance UK, where thanks to them, the people they look after, represent, have a package where they get access to physiotherapists or health professionals through a health cash plan. And I think this is something that the musician sector should do as a matter of urgency. I mean, this is no joke. If you're affected by this, it's an absolute nightmare. And so as much as we're kind of reassuring you of how important it is, actually action needs to be taken on quickly, I'd say. So in terms of occupational safety and health, so this is a few slides about why it works, and that investment pays off. The research shows that if you have occupational health, then it pays back, usually within 5 years, sometimes earlier. You get, productivity. For a musician, what does that mean? But obviously that means you're back at work playing your musical instrument and less time off sick leave. Productivity is maybe not so relevant to this sector. Ergonomic, this is something where, which means you have a sit, stand, chair, or some kind of intervention that's pretty obvious, and there is good evidence for that, and short payback. If you can do something sort of quick and easy to help, particularly with musculoskeletal issues, ergonomic intervention is definitely recommended. And that doesn't, you have to look at it in terms of an evidence base. That isn't not necessarily about doing a sort of a desk assessment. This is about simple things that make a difference. So, for example, in the construction sector, people who have been helped to carry plasterboards, and I'm sure for different musical areas, there's things you can do just to make your life a bit easier and avoid injury. Workplace health promotion. Now, this is very trendy at the moment. Everyone's thinking about workplace health, but it's not about fruit, sitting around. And there's a lot of kind of fluff and hot air, actually, and you have to be really careful about what you're doing here. So if your orchestra's putting fruit around, that's not going to make a difference. But it really is about effective interventions that are evaluated, and rather than just someone's whim. And these are some of the things that really work. Smoking cessation, there is dietary, but a much more systematic approach to that. And actually, overall, as much as these workplace health interventions are important, one of the key sort of preventative things you can do is to ensure that management are aware how much their impact is in terms of your stress and culture. And often things do boil down to the culture of the organisation, whether you've got a good manager and who is responsible for you. Are they on your side? Are they kind of empowering you? And so it's a combination of that management support for you, as well as interventions for your workplace health that really work for things like stress, and also for things like anxiety and depression. For anxiety and depression, what works, one of the bullet points is education for managers, and that might be things like mental health first aid training, although the evidence for that actually, despite a lot of people doing it, it's pretty unclear, although it can affect your organizational culture and people's openness about mental health. Actually, does it impact on people? It's unclear. But the other things in terms of sort of counselling, access to cognitive behavioural therapy, treatment, getting access to that. So there are ways which you can do that. It's not necessarily occupational health. So there's these things called employee assistance providers, and so you can contract to get access to, say, 6 sessions of counselling for very reasonable fees. So an EAP, employee assistance program, along with occupational health, you're really covering a lot of bases, and that's a good place to start. Clearly, workload. I mean, as Claire said, I mean, I think people can burn out, work too hard, and that we know that is an issue. You know, if you're working late and driving home, real risk of people driving home and getting into a crash because they're tired. And, these kind of shift issues are very, very real. So here's a kind of slide looking at, again, sort of what works, what doesn't work in terms of occupational health. And yeah, I suppose it's just, as I said, in terms of return to work, it's good right across the sectors. It's really important that there's timely, quick intervention to help people. What you don't want is to sort of get signed off by a GP for months and months, and then your own confidence and ability to return to work can be really affected. And it's good to be quick and rapid about this. Musculoskeletal for manufacturing warehouses is strong. It's just, you know, being clear about what works elsewhere, physiotherapy, for example. And health surveillance is important. You know, for big business, you need to understand what the risks are, perhaps less relevant for musicians. So here's the benefits again. I suppose this is for a conversation for you with your boss or your employer or your contractor. You know, it's going to be beneficial for both you, your employer, and, you know, if you care about the economy, it's going to affect that, and we know it does actually. So you know, this is for us to lobby, and there's a lot of interest actually from government in this. As I said, I'll come on to that. So in terms of self-employed workforce, good work is good for you. You know, do you have higher work satisfaction? Are you less likely to seek healthcare services until you're really sick? And that is a real risk if that's the case, and we don't want that to happen, and encourage anyone who's self-employed to seek help early as much as you might want to continue your role as a musician. Actually, in long term, you're more likely to continue as a musician if you seek help early. And it's difficult to access. We know occupational health can be this thing that people haven't heard of, or think, oh, that's just for some big business or NHS trust. But occupational health, you know, is the term used for helping with your workplace health, helping with you getting back to work. And contracts aren't in place effectively, I think, in this sector and many small businesses. And I suppose the point of this webinar is to say we need to get that in place, you know, using BAPAM, but also, you know, with your musicians' organisations, they need to put something in place. So the backstop is the health and safety executive, and there are some duties, health and safety at work, and you need to act, and management of health and safety at work regulations. You know, these are areas where there's court cases regularly, and it's about assessing what your health and safety risks are, and if your employer is putting in sort of risky activities for you to do, and then you come a cropper, then you can take them to court, or a health and safety executive will. So this is about doing a risk assessment about what might cause harm and responsibility. And as much as people go, oh, health and safety, what a load of nonsense. Actually, this is really important in terms of the fundamentals. And I would like to see the health and safety executive doing more sort of legal cases in musculoskeletal and mental health, which is obviously the big issues, and obviously the burden of proof for that is hard. You know, did you working till 2 o'clock in the morning in a gig cause you mental health issues or a crash later? It's difficult to go to court on that, but I think the government, from what I can see, is thinking perhaps post-Brexit to try and reassure workers that not all is lost, that they will be doing something in this area. So this is the future government policy activity. We're expecting a consultation to scale up occupational health, which is only half the population at the moment. The GP does do something called a fit note, and does that work? Or, you know, it's not sure whether the GP is really the best person to sign it off. They're not that interested and they're busy enough. But there's certainly better access is needed for people who are off sick, either through occupational health or through GP practice. And there's all kinds of initiatives the government's thinking about, like making every place a better, sort of healthy workplace. You know, should they incentivize small business to invest in this area? and we will obviously be in touch about us all contributing to that consultation. It's probably going to be April, but we don't know. So this is an example actually that you brought out when we discussed, Claire, about Uber, and I think that's not all is lost, is it, in terms of self-employed and people taking these new organisations like Uber to court to say that you can't treat people just as slaves to them, and you need to put in insurance, sick pay, maternity, paternity, and so hope people are perhaps they're catching up. They're not at the head of the curve really in terms of how employment is changing in the UK, but it's good to see Uber being challenged and benefits for those drivers, and that needs to happen for musicians too. You know, it's just outrageous really that people are left high and dry. So I suppose what I'm saying, overall it's cost effective to invest in occupational health. Certainly it is for musicians' health. There's a broad duty of care regardless of your status. BAPAM provides great health for people. There's a solution there, but I think more can be done. And we know a vibrant, healthy music sector is good for everyone. You wrote that, didn't you, Claire?
I wrote that, yes. Thank you very much, Nick, for that. I mean, I think listening to that, working specifically with musicians is very instructive. A lot of it feels as if it's relevant to large employers, but just understanding what the evidence base says, I think is very helpful as the music industry thinks about developing occupational health for all musicians. And my sense is that the industry, the organisations in the industry, the charities in the industry are hugely concerned about the health of people, but actually because there's this very high level of self-employment, genuinely it's difficult to work out what you can do individually, and it perhaps needs a collective response. So I think the learning from what's happened with the B&CE health passport, how construction have dealt with this when you've got lots of individuals who are self-employed, what can we learn from that? I think we're all trying to do the best that we can within the current context that we're working in, but I'm extremely grateful to you taking the time to share some of that evidence with us, to help us think through what the next best step is. And in link to that, I wanted to draw people's attention to the Royal Society of Medicine's conference, which is on this same topic, which is the occupational health clinicians, some top rehabilitation people from the NHS, together with Public Health England, coming together with the industry to think about occupational health in the performing arts. And what's interesting is that occupational health and government are interested in what we do in performing arts because we are the original gig economy. And if you've been listening to the news, you'll hear that discussion about the gig economy a lot, because it is a very live policy issue. So as Nick said, there's this consultation coming up. We have a very good opportunity, I think, to influence that, but what we need to do is to think about what it is we really want and what incentives could be in place in order to provide it. So a couple of resources here, the Journal of Occupational Medicine, if you're interested. And I'm happy to turn it over to questions now.
Okay, perfect. Thank you very much to Claire and Nick for the presentation. I will head over for questions. If you have any other questions, feel free to send them to us and we can get in touch with Claire and Nick afterwards. Is there a multidisciplinary clinic for instrumentalists as well as singers?
I'll pick up that one. I mean, I'm not aware of there being quite the same NHS provision as there is for professional voice users. And I should say there are a number of clinics, but they're not huge numbers. They are quite specialist in the NHS. But at BAPAM we do have a number of specialists who do liaise with each other. So you might come in and see a physiotherapist or an osteopath, and if there's a problem which might need a consultant, you can be referred to a BAPAM consultant for a second assessment. I mean, that's in the for musculoskeletal issues. We tend to look at the person when somebody calls us as a patient. We tend to look at the issues that they present with, and actually it's true to say that somebody might come in with a shoulder pain, for example, and actually when the clinician is talking to them, they realize that there's a psychosocial issue there as well, and so would then be able to refer on. So quite often we'll have a GP-led clinic because they are generalists and they can deal with a number of different issues and make sure that there's a good care pathway for everything that the person might be presenting with. So if it's not quite the same as everybody sitting around you having a good look at what's going on, but there is that ability. And it's worth mentioning actually that we have got some very exciting work going on where we've got clinicians working with educators, because from our hand surgeon Mark Phillips is working with Penelope Roskell, a pianist, so that when they see some of their patients, they can look at a clinic. Mark will look at from a clinical perspective at what's happening with their hands, but actually from an educational perspective, Penelope can say, well, in fact, now we know this, I can see, maybe the technique could change and it would, start, you're compensating in this way, I can see why. So you've got a number of people in that context who have different skills and different ways of looking at the same problem. So we're going to be running a conference on this actually in November, which I'm really looking forward to, and getting people to present about their work. And I think we've had a very siloed approach, I think, between the clinicians and the educators, and actually everyone's trying to solve the same problem. So I'm really looking forward to that.
Yeah, I mean, increasingly as the workforce gets older, people in Britain will have many different conditions, and also there's that circularity, as Claire said, between, say, musculoskeletal and mental health and musculoskeletal issues. So actually a multidisciplinary approach, as you say, Jason, is critical, because things feed each other, but also as we get older, I think there's some scary facts, like when you're over 60, the average is 3 different conditions an average person's dealing with. So how do you deal with diabetes and musculoskeletal and mental health? It's complicated.